let's work on infant CPR. Have you ever taken a CPR class? It's a really scary idea, but it's not difficult. It's especially intimidating when you're talking about your precious baby. So I want to give you some tips and go over the steps of it, and hopefully you'll feel more comfortable with the idea. Even bigger hope, you never have to use it, but it's good to have in your back pocket. I teach from the American Heart Association, and they worked really hard over the last 20 years to make CPR uniform between adults, infants, and children. So with an adult body, we follow the same steps with everybody. The difference is the size of the bodies. With an adult body, if your partner goes unconscious and you believe they need CPR, we leave them on the floor. They're heavy, they'd be hard to move upwards. With an infant, we pick them up and put them at our height on a table or a counter. You can use a changing table in the baby's room. Just throw the pad on the floor. You want a hard, firm surface, but we want it up high. You can do CPR on the floor on an infant if you need to. It's just awkward to do good compressions with your tail end up in the air because babies only come 6 to 8 inches off the ground. Another difference with the compressions is where our hands go. So with an adult, we use the heel of our hand in the center of the chest. We take 2 hands together, we get on our knees, and we rock from our hips. Our hips are the pivot point. This is so that we can put lots of pressure and do a deep compression because their bodies are thicker. We need to go down about 3 inches on an adult. With an infant, their bodies are so small that we use 2 fingers in the center of the chest, and our pivot point is our elbow. So we only go down an inch or 2, just like this. So we're not as likely to break any ribs or do any internal damage with an infant. I always tell the parents in my classes, don't worry about hurting the baby. It's important to remember that if you don't have a heartbeat, it doesn't get any worse. So everything you do can only improve the baby's situation. So kind of put that stress aside for right now, and we'll just focus on trying to save the baby. Breathing is a little different with infants also. Adults have big lungs. So whenever we do breaths on an adult, when we do breaths on an adult, we do big breaths. So we go, babies have little tiny lungs. So when you do breaths on a baby, you go 2 puffs of air, 1 second each. We just want enough that we raise the chest. We don't want to make a big bubble of the chest, just enough to raise it. You're not going to pop the lungs on a baby if you get stressed and you blow too hard. What happens is all of that extra air comes out and goes in the abdomen, and it can cause throwing up, which slows down compressions and makes them less efficient. Another difference is how we attach to the baby's face. With adults, we pinch their nose, we pull back their chin, we do those big breaths. Well, babies have these little perfect breastfeeding noses. They're all wide and flat. They're made to be pressed up against a breast and still be able to breathe. So with babies, we have to make a very big mouth and cover from the tip of the nose to the bottom lip. There is nothing delicate about it. It feels really awkward. It's like eating the baby's face. This is what it looks like. So it's kind of weird, but it's how we do it. If you don't cover the nose, what happens is when you blow in the mouth, the air just comes out the nose and hits you in the cheek. And that's not what we want it to do. We want it to go down into the lungs and push all of the oxygen that we moved with compressions into the more absorbent parts of the lungs. So babies get the benefit of that. To practice along with me, since you won't have a CPR doll at home, you could grab a throw cushion or a doll or a stuffed animal. Even if it's just a throw cushion like this, you can put it in front of you, use your fingers, and while I'm doing the compressions, you do them with me and count out loud. Doing something that has a little bit of resistance will help with your muscle memory, and matching it up with the counting helps too. So you would go 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 26, 27, 28, 29, 30. That would be a full set of compressions. When we do compressions, we try to do them at a rate of 100 to 120 per minute. That matches up with the old Bee Gees song, Staying Alive. So it's that, you don't really want me to sing. But it's kind of a catchy song, makes it easy to remember. The counting out loud and practicing together will help with your muscle memory. So that's a good thing. All right, so the overall steps of CPR. And like I said, these are the same for everybody. Making sure the scene is safe. That's number one. With an adult, that may mean coming up on a car accident and making sure you're not doing CPR in a lane of traffic. If you get hit by a bus, you don't save anyone. With an infant, that's often more about making sure that they're in an appropriate place to do CPR, on a hard, firm surface, on their back, facing up. You can't do CPR in a bed, it bounces. You can't do CPR in a car seat. So you need to move them to a hard, firm surface. The second step is checking for response. You may remember from adult CPR classes that you would tap on the shoulders and go, hey, hey, hey. Well, with babies, we don't do that. With babies, we unswaddle them, grab hold of their foot, and go, baby, baby, wake up, wake up. This is where we're looking for a response, just in case the baby is sleeping super hard. Not very likely. If you don't get a response, you want to yell for help. No one wants to do this on their own. Help, help! If someone comes, have them call 911. If no one comes, another difference between adults and infants, if it was your partner and they're on the floor unconscious and you've gone through the beginning steps, you yell for help and no one came, you would get up and go find your phone. And then you would call 911 and come back and do CPR. Because babies have a smaller respiratory system, we want to do 5 sets of compressions and breathing to make sure they have oxygen to all of their cells before we take that 1.5 minutes or 2 minutes to go find our phone. The exception to that is if you see your child go unconscious. If you see it happen and you know it just now happened, then you can take the minute or so to go find your phone, do it as fast as you can. If not, do your 5 compressions and breathing. It's a 2-minute round of CPR so that they have full oxygen to all their cells, and then go find your phone. When you call 911, do not hang up on them. The 911 operators are listening to what's going on, even if you're not talking directly to them. They're communicating with paramedics so that when they get to your house, they know what to do. If you have pets, particularly dogs, make sure you put them away before EMS gets there. The EMS workers need to make sure that they're safe, and so if your dogs are out, they might be stressed because of the emergency. The EMS workers won't come in until they're put away. So put your animals away and unlock your front door. Something that a lot of people don't think about is unlocking the front door. EMS will break your door down if they have to. Once they're called, they're coming in your house, and you won't care because it's your baby. But it takes longer. So it makes so much more sense to unlock the front door or even open it, and then take the baby to a table near the front door where they can find you and go right back to what you were doing. So, make sure the scene is safe. Check for response. Call 911. If no one comes, we keep going. So with an infant, for us to keep going, we're going to lean down. We're going to look down the length of their body. We are looking for movement, motion, movement, moaning, and response. So MMR. Movement would be chest rise, little wiggly toes, listening for the sound of their breath, feeling for breath on our cheek. If we don't see, feel, or hear anything in the first 4 or 5 seconds, Then we'll go ahead and move into CPR. We're going to find the center of the chest. That's going to be below where the nipple is, but above the xiphoid process. So where your ribs come together, above that area below here, center chest. Put 2 fingers up and down. Put your other hand on the top of the head. We don't need to pull the head back. We just don't want it coming forward in our compressions. We want it to stay in a neutral position. So the nose points to the sky. I'm also going to, as I do my compressions, I'm going to put down 1 finger for each set of compressions. And that will help me keep up with doing 5 sets. So we're going to do 30 compressions at a rate of 100 to 120 per minute. Count with me. Are you ready with your pillow or your doll or your stuffed animal? All right. 1, 2, 3, 4, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 29, 30. And then we'll give 2 breaths. Cover the mouth and the nose. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. Last set. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 12, 13, 14, 15, 16, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. And we're going to end with 2 breaths. Oh, that's a lot of work. Okay, so then we're going to pick up our baby, take them with us, go find our phone, call 911, tell them what happened, hold your phone with you, put your dogs away, unlock your front door, go back to the nearest spot to do CPR, and go right back into compressions and breathing. 1, 2, 3, 4. Oh, so I get some questions pretty often. One is about hand position. In a real baby, it's pretty easy to see where that indentation is, where the breastbone runs down the center of the chest. Go right below the nipples, above the xiphoid process. I use the tip of my fingers straight down this way. Some people use the pads of their fingers, like this, and that's okay too. Sometimes people will use their thumb, and that's all right. You just want to make sure you stay on that breastbone so you're less likely to damage any ribs. Oh, I don't worry about any type of internal injuries. You are going to tear the cartilage where the rib cage hits the breastbone. That's something a lot of people don't realize. It's the easiest thing to mess up on CPR is not to go deep enough. You have to, where the rib cage comes in, there's a band of cartilage that connects it to the breastbone. In order to get that breastbone to float, to compress the heart, to move the blood around the body, which carries all of the oxygen, you have to disconnect the cartilage. Cartilage regrows. It's flexible like your nose or your ears, and so you have to press down far enough that you get past the stretchy point where it actually tears. That way you are pushing the blood out of the heart each time, and then when you move your hand up, the blood comes back in. You're helping the heart be the pump that it needs to be to move the blood around the baby's body. Once you've done compressions, once you've actually pushed down and torn that cartilage, even if the baby comes to, you have to go through EMS to get to the hospital. Because while we don't worry about hurting the baby when they don't have a heartbeat, if we were to cause any type of problems, we want an ambulance with all of its equipment to be able to deal with any issues on the way to the hospital. So make sure that if you've done compressions, you're calling 911, you're going through the ambulance. If you think your baby's coming back to you, they've moved a little, or maybe they made a noise, stop what you're doing, watch them for 4 or 5 seconds. You want to make sure you didn't accidentally move them, or the noise wasn't just the air coming in and out of the lungs. So we want to wait. If we're not sure, we would go right back to doing compressions and breathing, because it's better to do compressions on an irregular heartbeat than not to do anything at all. Do your 5 sets. Go find the phone, call 911. Put your dogs away, open your front door, go right back to doing compressions and breathing. EMS should be there pretty soon. Oh, the good thing about infant CPR is that you're not likely to have to use it. But it's important to learn it, because even 2 or 3 minutes of your baby not having a heartbeat is too long. So we want to know how to approach it if we need to. I will write out the steps that we went through, and that way you can refer to them. I hope you're feeling a little bit more comfortable about your ability to perform infant CPR.